Hi, it's Sarah here from Thriving Solo, and today we're going to look at another mindset issue. And this is about how to make clear decisions without second guessing yourself. So, why is this a bit of an issue for solo health providers? I think that it's one of those issues where, because we're working on our own, we've not got anybody to sort of chat things over with. If we came straight from training into our clinic, we'll have had that in training where we got a chance to discuss cases, to think about how we could approach things, and then you're suddenly working on your own and there's nobody to really have that chat with. So it's also an issue when you're working solo of decision fatigue, because you're not just making decisions about your clinical cases, you're also making all these business decisions day to day as well. So one of the things that we want to look at is how can we make our process a little bit more streamlined and supportive to help us through the day to day. There might also be a case where you want to set up and perhaps engage some sort of clinical supervision. Certainly, that was something that I did in my early days in clinic. I joined a group supervision setting so that there were actually a couple of my colleagues that I'd gone through training with, and we would get together once a month with a clinical supervisor to talk about not just the tricky cases that we'd had, but also the sort of mechanics of managing our business. So that might be something that you want to consider, but in the absence of that, there are also things that we can do to just make things a little bit easier for ourselves. So one of the things that we can do is just consider what the most common confidence drains are. And one of those is having too many options. I've spoken about this for our clients about the decision fatigue and that we shouldn't offer too many options because it actually makes life, although it seems kind and transparent, it actually leads to, as I say, decision fatigue. And that applies to us as well. So having more tools at our disposal can actually make it tougher to actually decide which we're going to use this week. And that means more second guessing. So, examples might be having different needling styles. You might have different exercise progressions, different manual techniques. Whichever your modality is, you will have got options, and we need to actually reduce some of those options to make our life a little bit easier. Another thing that makes it difficult for us to be confident and stop second guessing ourselves is the fear of making the wrong call. Now, we really need to set this aside because the wrong call for one client is not the wrong call for another one. So you have to decide, okay, what is the best course of action for this client at this time? Because as well, things will, change as they go along. You will see how they respond to treatment. One of the things, though, that it's worth keeping in mind here in terms of wrong call is making sure that you know about red flags and the most common sort of fear spots. So what are the things that you're most worried about, and what would be a red flag and a reason to refer elsewhere? It's good to have that so that you can set your mind at ease in terms of the most, the thing that is most worrying, shall we say. So another thing that makes life more difficult for us as solo health providers is lack of a repeatable process. If you decide differently every time, then it becomes more difficult to trust your own thinking because you don't have the evidence that you can follow to know whether your treatment is working or not. If you keep changing it every time, how do you know when it is working with a client and when you do need to change and come up with something different? You're also spending more time deciding rather than doing. So what makes a process repeatable helps us then to have more confidence in what we're doing. Another issue that can make it difficult for us day to day is when you have emotional carryover from a tough session. One intense session can colour the rest of the day. It can colour every decision after it. So if, for example, you've had a patient that cried or got angry or challenged your plan or even just reminded you of a past case, then that can be quite difficult to move on from. And this is where you do need to go back and do your reset, make sure that you've got your mind and body in the right place for the next client. And just remember that feelings are data, not directions. You can use that information to work out what is a good way for you to go forward from here rather than getting stuck and worrying about it. So now we want to have a look at how we can gather clinical confidence. And there's a 5-step framework that you can apply today, the CLEAR framework. So CLEAR, the first C is clarify the goal. What are we trying to change and what do I need to respect? So what is the outcome that's wanted and what constraints are there in place? An example might be reducing pain with stairs, improving sleep quality, increasing shoulder range for overhead work. Constraint examples might be the time that they've got to be able to attend sessions, budget, or it could be comorbidities, what medications they're on, is there pregnancy involved? So that's what I say, we need to think about, okay, what are we trying to change and what constraints are in place? The next step is to limit options. So we've had C, clarify the goal, limit options. We only want to look at 2 to 3 viable paths. You've got more options than that. We need to constrain it so that we're not overwhelmed with too many decisions. Fewer options makes it easier to compare the trade-offs, and it makes it easier to see, is this working? Make sure that you keep it going for long enough to find out whether it's working. But path A might be symptom relief first and then rehab. Path B might be a graded exposure now and lighter hands-on. And you can discuss this with the client to find out what they feel comfortable with. You can say, we've got a couple of good options here. Here's what each one looks like. And some of this might depend on what your clients are capable of at this point in time. When I was seeing my clients, I would talk about the lifestyle changes that they could make, but I would also take into account where they were starting from, and if they were in, a lot of pain now, they can't focus on lifestyle changes necessarily at that time. So I would offer them the option to say, there are certain lifestyle things that we can do to improve where you are, but you might not be ready for those at this point. Let me know when you can start thinking about them. So we've got the C and the L. The next one is E, and this is evidence and experience check. And it's looking at what's true versus what you might be afraid of. And to do that, we just need to look at what the findings are, what the patterns are, some objective measures, and any prior response to care. So, have they been treated for this condition in the past? Did it work? How long did it work for? How long did it take them to slip back? Are there any known contraindications? Afraid examples might just be you worrying about, if this does flare, they'll never come back. I should be able to fix this fast. You don't know this until you've started to provide care. You don't know what the response is going to be. So just remind yourself that if you see a red flag, this step ends with referral, not debate. But apart from that, look at your evidence, look at the findings, and just remind yourself that you're looking at the evidence to support whether or not something is true or just something that you're afraid of. The next step is A, act on the next smallest step. So trial one technique, not 5. Give one home task, not a full lifestyle change. And book a short recheck so that you can see what's happening sooner rather than later. You want to know, how are they responding to the treatment? How are they responding to exercises that you've given them at home? If they're actually doing them, have they been able to do them? And like I say, you don't need the whole plan today, you just need the next step. So R is review quickly. Like I say, make sure that you don't spread the sessions out too long that you can't actually respond to what is happening when they actually have a response to treatment. Keep the review tight. Just use 3 prompts. What changed since last time? What did I learn about the pattern? What will I do next because of that? And this can build your trust, and it helps with future decisions. They get easier each time. And this is where having niched down really helps you out, because you start to see these patterns sooner. So do take a look at the other video and blog post that I've got about niching down and presenting a clear offer, because if you're seeing the same kinds of patients day after day, not necessarily session after session, but day after day, then you can see these steps more clearly, this clear session, and you get to know what is working quicker, so that you know when it is appropriate to pivot to a different technique and try something different, because you're not getting the results that you have had with other clients in similar positions. Okay, so like I say, that is the clear step. So we're just going to, as I say, look at clarify, limit the options, look at the evidence, act, and review quickly. So I hope that gives you a clear system to be able to apply. We're going to have a look more at this through mindset in future sessions. But the main thing for the moment, like I say, is don't get overwhelmed just because you're working alone. If you are feeling overwhelmed, then have a look at what other support structures that are out there that can help you apply this clear system to help you day to day, and see how that works. Like I say, try not to be treating too many different types of issues at once, because undermines the clear system, and it reduces the evidence that you've got for being able to go forward with other clients. So, like I say, I'll link to a few other helpful blog posts and videos, but for the moment, try to stop second guessing yourself. Trust in your training, trust in your ability, and trust the evidence that you are seeing with your clients. Thank you for stopping by, and I'll be back with another tip soon.